Nick, you wrote something about that this week, some new guidance for practices on how to record same-day urgent access. Why is this interesting?
So from April, practices will be expected to offer same-day access for clinically urgent cases. Is that a big deal? Well, NHS England has said it thinks most urgent patients are already seen on the same day. They're part of the 46% of patients who get same-day appointments already. A government minister has said something similar as well, said that in this last week. GPs have been really annoyed by this bit of the GP contract for the year ahead, and I think mainly because there's a real lack of clarity around what is urgent. NHS England has said practices decide this as they do now, but the concern is around the expectation it creates among patients, a sense of a right to be seen on the same day. The way the NHS will measure whether practices are delivering same-day access for urgent patients will be through data it already collects on appointments in general practice. So that data already segments appointments by type. And one of the options practices can record appointments under is general consultation acute. So NHS England thinks that category is currently underused. So essentially, more practices could mark more appointments as acute, aka urgent, over the coming year. And as if by magic, the plan for same-day access for urgent patients will have been delivered. So what this feels like is government spin in plain sight. A new promise to patients is announced. GPs are told, actually, it's no different from what you already do. Data collection changes to show a transformation, and the government can claim its promise has been delivered. But the risk, though, for general practice is that patients expect to see a difference. And if their experience hasn't changed, because from what we're hearing, there isn't actually any change, GP practices themselves bear the brunt of patients' anger and frustration.